Okay, the last topics here on reproduction are birth control and STDs. Um, Birth control involves different methods that people employ to control or regulate the number of conceptions that they will have in their lifespan. The most basic and successful way to avoid um, giving birth to a baby is abstinence. If you simply do not engage in sexual intercourse, you will not have a pregnancy. A male cannot get a female pregnant if he doesn't have sex. A female cannot get pregnant if she doesn't have sex. Furthermore, that does definitely avoid sexually transmitted disease transmission. Um, Most churches also, in addition to abstinence, they also encourage people to practice natural family planning. Uh, Natural family planning depends on a woman understanding the specific timing of her menstrual cycle and avoiding intercourse any point near ovulation. This usually is the least effective method at preventing conception. There were a lot of oops babies in the past where families had an extra child or two because of the natural family planning system. Prior to the 1960s, that really it was either abstinence or natural family planning that people use to try to regulate pregnancy. If a woman checks vaginal mucus and uses a thermometer to determine vaginal temperature, she can chart ovulation pretty carefully. But sperm can remain alive longer than a norm and outside the male body, and females can ovulate at multiple times during a month, especially women that are under stress involved in careers. If a woman is at home, she's not in a job, she's sleeping exactly 8 hours a night, she has very little stress during the day, she has a regular exercise schedule, and life is very routine, she probably can use natural family planning to great success. But the more stress she is under, the more difficult it will be to chart her cycle and regulate intercourse around the cycle. Both of these, though, are totally acceptable to most religions because they don't separate conception from intercourse. There is always the possibility intercourse could result in a conception. Now, there are artificial contraceptive methods that prevent conception. The pill is one of those. Depo-Provera, which is a progesterone shot, can do a long-term prevention of ovulation. The patch, which is Ortho-Evra, or Implanon, which is a silicone capsule of progesterone, and the NuvaRing, which is a vaginal ring that releases hormones, all involve hormones, which are artificial estrogen and progesterone that prevent a woman from ovulating, and furthermore can prevent a woman from having regular periods. Without ovulation, eggs don't get released, and then there are no conceptions. Generally speaking, the pill is less effective than the patch, Implanon, and the NuvaRing because the pill demands that you remember to take the pill every day. If you forget one day, you can ovulate as a result of that and get pregnant. Whereas if you have a shot or an Implanon or a NuvaRing implant, then there's no need to remember something like a pill. The hormones are just constantly being released in the body. Males can use condoms to prevent sperm from reaching the uterus. The condom does inhibit the transmission of STDs, but condoms often get put on wrong, they tear, or otherwise are stored in people's pockets or something, and they get holes poked in them and they fail. The cervical cap and diaphragm is almost never used anymore. Those were actually inserted up the vagina before intercourse to prevent sperm from reaching the egg. The spermicidal jelly actually killed sperm. There are permanent methods of birth control, tubal ligation and a vasectomy. Tubal ligation is a surgery where through the abdominal wall, a woman's oviducts are cut and folded over. Vasectomy, a doctor cuts through the scrotal wall and ties off a male's vas deferens and folds them back, ties them off. Those pretty much permanently prevent pregnancy. They do sometimes fail, but the failure rate is really low. There is a new, although there are lawsuits over it, there's a new birth control method for females called Assure, which is little plastic augers that are actually screwed into the oviducts from the uterus, and they block the uterus and they form scar tissue, which prevents eggs and sperm from meeting. But there have been some problems with it, so I don't know what the final verdict is on Assure. These methods, tubal ligation, vasectomy, the cervical caps, the condom, all of these prevent conception. Okay, so they don't kill any babies, they just prevent conception. If they don't prevent conception, then conception occurs. And none of these are perfect. Even Depo-Provera, Implanon, sometimes they fail, but they have extremely high success rates. Of all of them, the artificial hormones being implanted have among the highest success rates. And there's one more coming up that has an extremely high success rate. There are other methods, though, that they're contraceptive but also abortive, meaning they allow pregnancy but then kill the fetus. It's very controversial. The IUD, it's also called the intrauterine device, is a device that's put in the uterus. It looks like this. It's actually straight, and then an instrument actually pushes this plastic rod up through the tube, and then these ears flip out, and that holds it in the uterus. This device actually, if it's got copper on it, it prevents implantation of an embryo, which means then that conception occurs, but then the baby dies. But there's a new type of IUD, and it has levonorgestrel on it, which is the Plan B pill I'll talk about in a minute. And it basically prevents implantation more effectively than the copper. The IUD now is the #1 birth control device used in the United States and worldwide. It's cheaper than the other systems, and the levonorgestrel Plan B strategy appears to be more effective. I've heard of more than 99% success rates, but I don't know for sure. Now, there are other abortive birth control systems. Mifepristone, or antiprogestin, is the abortion pill. It's actually two chemicals together that chemically cause menstruation of an embryo, but it must be taken within 49 days of the last menstrual period for it to work. And then there's Plan B. Levonorgestrel, which is the morning after pill, you have to take within 72 hours of unprotected sex. That will prevent implantation of the embryo and subsequent pregnancy. So this chemical prevents the embryo from implanting. These two chemicals they just actually cause the embryo to detach from the uterine wall, and then they're discarded usually in a mini birthing event. So these are extremely controversial birth control systems because they allow a pregnancy, and they're abortive. They're abortive methods. But do keep in mind, the IUD now has become the #1 birth control device worldwide. It has been the #1 birth control device worldwide. It is now passed up the pill in the United States. It's the #1 birth control device in the United States too. Now, having sex means that you are also exposing yourself not just to pregnancy, but to infections from parasites. There are bacterial infections that can cause real problems. Syphilis is totally disgusting, causing pus-emitting lesions on the skin in the area of sexual contact, which can be fatal. And these are the scars left by syphilitic lesions on somebody's chest. Gonorrhea infects the vagina or the oviducts in females, or the urethra and vas deferens in males. It can definitely lead to sterility in both genders. Chlamydia is the #1 sexually transmitted disease on college campuses across the United States. It can lead to sterility. Females are usually not symptomatic, while males may or may not be symptomatic. This is gonorrhea, infection of the eye. This is chlamydia, infection of the eye. Infants get that when they're born to a mother that carries the infection in their vagina, and the antibiotic drops were not placed in the baby's eyes. Now, viruses can also be sexually transmitted. HIV is an STD that can kill you because it disables your immune system. Herpes is an STD. It's usually not fatal, almost always not fatal, but it produces very painful cold sores on the area of sexual contact. Not curable, but treatable. Hepatitis B infects the liver. Most of you were vaccinated against hepatitis B. That should no longer be an STD at this point. And then there's genital warts, which are HPV. The new vaccine to HPV will prevent genital warts. If you get warts on your cervix and they are there for years, that can lead to cervical cancer, and that can easily be fatal. So there is a new vaccine, the HPV vaccine, to prevent genital warts from forming on the cervix and later cancer. Then there's also disgusting protozoan infections. Trichomoniasis is a protozoan that infects the vagina and the oviducts in females, or the urethra and vas deferens in males. Females have a really noticeable vaginal odorous discharge. It's completely disgusting. Homeless people get this. Usually this comes from very poor body hygiene. And then lastly, you can get itch mites, which actually tunnel through your skin and cause the most unbelievable itching in the pubic area, and pubic lice, which are surface insects that crawl around on the surface of your body, can live in pubic hair. Both of those are highly contagious, but they are both treatable. And that concludes the discussion on birth control devices and sexually transmitted diseases.